Democratic challenger Jon Ossoff faced an empty podium. Incumbent Republican Senator David Perdue was a no-show.
It shows an astonishing arrogance and sense of entitlement for Georgia's senior U.S. senator to believe he shouldn't have to debate at a moment like this in our history.
The president campaigned for both candidates Saturday night in Georgia, but spent most of his hour-and-a-half-long speech complaining about his own election results. The candidates themselves spent less than 3 minutes on stage with the president.
You must go vote and vote early.
He pushed supporters to vote while casting doubt on the election process by repeating false claims he was cheated out of a victory.
We'll still win it. And they're going to try and rig this election, too.
His refusal to concede has sparked a Republican battle in Georgia. He has pressured Governor Brian Kemp to call the state's legislature into special session to overturn Joe Biden's victory here. Kemp refused again in a statement Sunday night, saying that is not an option allowed under state or federal law.
And you got to make sure your governor gets a lot tougher than he's been. He's got to get a lot tougher.
The president has also been tough on Georgia's Republican Secretary of State. Brad Raffensperger says there was no evidence of fraud in Georgia.
But right now, we don't see anything that would overturn, the will of the people here in Georgia.
Top Republicans here are worried that the president focusing on the fraud allegations could undermine something here. It could discourage Republicans from turning out at next month's runoff. Vlad and Emery.
Greg Bluestein, political reporter at the Atlanta Journal-Constitution, was a panelist at the Loeffler-Warnock debate, and he's joining us now. So thank you so much for joining us, first off. Senator Loeffler, and Reverend Raphael Warnock certainly didn't hesitate to go after each other, and they were both asked about the president's baseless accusations of voter fraud. I want to play some of that sound.
Greg, it's very clear that there were issues in this election. There are 250 investigations open, including an investigation into one of my opponent's organizations, for voter fraud.
It's time to put this behind us and get focused on the concerns of ordinary people. While she's playing political games, trying to represent somebody who doesn't live in Georgia, Georgians are wondering when are they going to get some COVID-19 relief.
So Senator Loeffler has been repeating the president's, talking points about voter fraud in the state and beyond. And I'm wondering, is she sort of sticking to this? Is the belief that this sort of talk will ignite the Republican base, will keep them engaged until they have to head back to the polls again? Because it seems like the sort of thing that would almost deter you from voting if you're told over and over again that the system is flawed and rigged.
Exactly. That's the message. That's the conflicting message here in Georgia that President Trump has pushed. It's vote in January 5th election, but they're also rigged. So it is sending the message to some Republicans to why bother. Now, to be clear, most Republicans are going to go out and vote, especially the people who showing up at these rallies who are paying attention to the races. But I've talked to more than a dozen Republicans at different events across Georgia who've said they are debating among themselves about whether to cast a ballot. And what you saw from Senator Loeffler, she hasn't quite said that she believes the election was rigged, but she also won't say whether or not she disavows President Trump. And that's because the president has continued to attack Republicans who have acknowledged Joe Biden's victory in Georgia, including Jeff Duncan, the lieutenant governor. The president called Jeff Duncan the other day a puppet of Governor Kemp and has gone relentlessly after Governor Kemp for refusing to call a special session that would illegally overturn the election results. So Kelly Loeffler and David Perdue have to walk this very fine line, not trying to demoralize Republican voters, but also not trying to antagonize the president.
Yeah, Greg, what is so fascinating to me is why some of these Republicans continue to show fealty to President Trump when he clearly, at the moment's notice where he feels that they are not 100% loyal to him, even if he's making baseless accusations or he's attacking reporters or Gold Star parents, that he's willing to toss them overboard, they continue to support him. Meanwhile, you had some questions about Reverend Warnock and whether or not he'd expand the Supreme Court or how much money he wanted to see in a COVID-19 relief package. Is he sort of distancing himself from the far left faction of the Democratic Party? And if so, why is that?
Yeah, I wouldn't say he's distancing himself because it's interesting. In Georgia, you used to have Democratic candidates run away from national figures like Bernie Sanders, like Nancy Pelosi. And now you've got both Jon Ossoff and Reverend Warnock embracing Bernie Sanders' recent endorsement of them. So they're not quite running away, but they also, Reverend Warnock was very hard to pin down. We couldn't pin him down on whether or not he supports expanding the Supreme Court or a dollar figure for what he expects Congress to pass in terms of stimulus, economic stimulus release for the pandemic. And I think he said it hasn't crossed his mind yet, but certainly both those questions have come up on the campaign trail as well. And I just don't think he wants to give Republicans a talking point, an attack advantage. But at the same time, these are pressing questions. And of course, the Supreme Court expansion would affect the daily lives of all of Georgians.
Overall, how do you think the debate went? Did voters hear the information that they needed in order to make a final decision?
I mean, I think voters heard a lot more talking points and a lot of dodging of some of the questions we wanted the candidates to answer. But I also think the candidates had a chance to clarify and expand on some of their policy points and some of their platforms. And of course, the clash between the candidates, when the candidates got to ask each other questions. You heard Reverend Warnock ask pointedly whether or not Senator Loeffler thinks Donald Trump lost the election. And you got to hear Kelly Loeffler attack Reverend Warnock and question him on some of the attack ads that here in Georgia we can't turn on TV without seeing. And so we heard Reverend Warnock get to respond to that as well. So I think that's valuable for the discourse as Georgians get ready to make up their minds.
Let's talk about Jon Ossoff, who's challenging incumbent Senator David Perdue for Georgia's other Senate seat. There was an empty podium. Senator Perdue refused to debate, and he did not show up. Still, Ossoff came out swinging at his opponent. I want to play a little bit of that.
The reason that our country has lagged the entire world at the efficacy of our response to this virus, the reason that we are losing thousands of people per day to this virus is because of the arrogance of politicians like David Perdue, so arrogant that he disregarded public health expertise, and so arrogant that he's not with us here today to answer questions.
I note that Mr. Ossoff then yesterday, as you know, Greg, tweeted a photo. It wasn't a photo, it was a little...
New York is closely monitoring hospital ICU beds as the state continues to grapple with the coronavirus pandemic. Governor Andrew Cuomo is updating on the state's response. Let's listen.
He did it in a way that was calming, but was truthful. And that's a hard balance, but he did that extraordinarily well. He's also been very kind to me. I've spoken to the doctor many, many times throughout this situation, and he's given me great advice and great guidance. He was also very helpful to New Yorkers on a personal level. He was very helpful to my brother Chris when he got COVID early on, gave him good advice. But the doctor has been a great, great friend to New York. I'm just worried when the doctor sends us the bill for all the consultation that he gave us. But you know what, doctor, maybe you could take the, just to ease bookkeeping, you take the Cuomo consultations, me and my brother, put them together on Chris's bill, send Chris the bill. He's a very generous person, my brother Chris, so I'm sure that'll be fine with him. Doctor, let me give you a sense of where we are and give you the facts today, and then I'd like to ask you a couple of questions to get your advice on where we go forward as this situation changes. Our positivity rate today, without what we call microclusters. Microclusters are the high problem areas in our state, which we have localized, and we have special strategies in them. And they have a higher percentage rate than the rest of the state. They're small zones, but they're intense positivities. Statewide, without those zones, we're at 4.2. If you add those zones in, we're at 4.7. The positivity in those high-intensity zones is 6.5. We did 152,000 tests yesterday. On a Sunday, tends to be our lower testing day. But we still did 152,000 tests. 80 New Yorkers passed away. They're in our thoughts and prayers. 160 additional hospitalizations, 22 ICU, and 13 intubations. Our RT, we estimate at about 1.2 now. When you look across the state, you see a very varied picture. This is number of people who are hospitalized, and we look at the percent of the population that is hospitalized. So, for example, the highest percent of hospitalization is actually upstate. Finger Lakes, that's Monroe, Rochester area, Buffalo, Western New York, Central New York. You come down to New York City, Long Island, we actually have a lower rate hospitalized than upstate, which is an exact flip of where we were in the spring. Spring, we had a largely downstate situation, and upstate, the situation was much better. New York State, we've done a couple of things that are different than other states. In New York, the state sets all the policies on close down. The state keeps numbers that are determinative of the policies. We don't do it on a county or a city level. This, to me, avoids what I call the hodgepodge effect. Hodgepodge is a technical medical term that we have here in New York. We also apply it to government. Hodgepodge, just a discoordinated mess. It also reduces forum shopping. You know, when you see states where one county's open, one county's closed, you want to go for dinner, you go to the neighboring county. You want to go get a haircut, you go to the neighboring county, which only increases the number of people traveling, which is exactly what you don't want to do. And it reduces the confusion. We're also then taking it to the next level. We try to coordinate with surrounding states. So if I'm going to close restaurants, I try to coordinate it with New Jersey, Connecticut, et cetera, because if I close a restaurant but you live in Brooklyn and you can drive to New Jersey, then all I did is increase the traffic in New Jersey. It's not a perfect coordination, but in lieu of a national set of firm guidelines, which is frankly what I would have liked to see, we have come up with a regional compact of guidelines. We have been very transparent and communicative with New Yorkers. We have websites. I give them numbers every day. I wanted them to hear the facts. If anything, I've been accused of being overly communicative, especially at home. But the more facts people know, I think, the better. And we have been religious about following the data and the science. We do more testing than any state in the United States by far. We have more data points by far, and we rely on the data. And it's not anecdotal, it's not political, it's not an opinion. And we also started something called the Surgeon Flex Public Health System Management, which is something we're going to be implementing in an increased way today. Surgeon Flex is not the most creative name, but what it says is we surge and we flex the hospital system in the state. We start with 54,000 hospital beds statewide. We can then mandate by the Department of Health, Dr. Howard Zucker to my left, Jim Malatras to his left, Gareth Rhodes to my far right, Melissa DeRosa to my right. You know, Dr. Zucker and Melissa, you've worked with them. But Dr. Zucker can order a 50% increase in beds, which we've done before. Dr. Zucker can order no elective surgeries, which we have done before. And we can create field hospital beds, which we've done before, and we can create several thousand field hospital beds. So when you look at our hospital capacity, we start with 54,000 beds. You can increase it by 50%. Takes you to 75,000 total bed capacity. Roughly 35,000 of those beds are now occupied. If you cancel elective surgery, we estimate that you reduce the number of occupied beds by about half. That takes us to a total system capacity of about 58,000 beds for COVID patients. Today we have 4,600 hospitalized. So that gives you a range of the capacity for the system. We can also add 5,000 additional field hospital beds. That would be, from my point of view, the last resource. We did that. The Jacob Javits Center, for example, we did 2,000 beds. Dr. Fauci, it looked like a field hospital in an army. You just saw an ocean of cots. And I just hope we never have to get to that point. Today, the Department of Health is going to issue an order saying hospitals have to increase their bed capacity 25%. We can issue up to 50%. They can do that physically, but we're only going to go to 25% because we don't have a capacity criticality at this moment. We are aware of staff resources. The staff comes into this stressed, right? They had, you want to talk about a long year. Nurses, doctors, hospital workers, 1199, they had the longest year of anyone. So they come into this stressed. We're going to ask retired doctors and nurses to sign up, and we will automatically re-register them in the state without cost. We believe we can get about another 20,000 nurses and doctors from this mechanism. And then the flex on the surgeon flex is we have 215 hospitals. What happened in the spring, interestingly, was not that the system was overwhelmed. Individual hospitals got overwhelmed. And the individual hospitals did not have the capacity to balance patients. Frankly, this was an education for me. So you have public hospital systems. And let's say you have a public hospital system that had 10 hospitals. One hospital gets overwhelmed. They did not have the capacity to balance those patients among their other 9 hospitals, right? So even in the public systems, before somebody walked into one hospital that was already overburdened, they didn't say, hold on, I'm going to put you in an ambulance and drive you to my sister hospital that has less volume. What our flex says is those hospitals have to flex patient load and share it first within their system. We also shift patient load among private hospitals, which was, frankly, more unorthodox, right? You go to NYU Langone, you think you're going to NYU Langone. What we say in the flex is if NYU Langone is filled or at capacity, we're going to transfer you to Mount Sinai or another hospital. And then we actually have the capacity to shift between public and private systems. None of this has been done before. It was highly disruptive for the hospital management system. But we started it in the spring. It went fine enough, and we now have had more experience in it. We've started the flex management system, where every night we get an inventory from every hospital doctor. How many patients do you have? How many ICU beds do you have? What capacity do you have? And we do that on a daily basis. If our hospital capacity becomes critical, we're going to close down that region. Period. We call close down a red zone. What is critical hospital capacity? Our formula is if your 7-day average shows that within 3 weeks you will hit critical hospital capacity, we close you down. So if your 7-day average says if that continues for 3 weeks, you're going to hit critical hospital capacity, we close you down. We want that 3-week buffer. And then we call critical 90% of your hospital capacity. So a little complicated. If your 7-day average says if it continues for 3 weeks, you're going to hit 90% of your hospital capacity, close down. CDC changed their guidance on Friday. Some have been critical about the changing guidance from CDC. I'm not. I believe as the facts change, your opinion changes. As the facts change, your strategy should change. I don't have a problem with that. But they offered additional guidance on indoor dining, especially. And we're going to follow their guidance. If after 5 days we haven't seen a stabilization in a region's hospital rate, we're going to clamp down on indoor dining. 5 days, if the hospitalization rate doesn't stabilize in New York City, we're going to close indoor dining. We're now at 25% in New York City. In the rest of the state, any region where the hospitalization rate doesn't stabilize, they're now at 50% capacity indoor dining. We're going to go to 25%. We have zones that are called orange zones where it's already closed. That wouldn't apply here. Bottom line for us, I see it as hospital capacity versus vaccination critical mass. I think that's the ultimate bottom line. Can your hospitals handle the increase until you start to see a reduction from the vaccinations? On the hospital capacity, do everything you can do to slow the spread, and then at the same time accelerate the vaccines. The frustrations we're seeing here, we estimate over 70% of the spread is coming from small gatherings, and that's a problem. We're going to go through the holiday season. I think there's going to be more small gatherings. I've been talking until I'm blue in the face about the apparent safety of being at home, the apparent safety of being with your family, but that can be misleading. Your brother, your sister, your mother can love you, but they can still infect you. I know you think you're sitting in your living room and you're safe, but your living room is not really a safe zone. This isn't a political question. Trump's CDC and the Biden advisors all agree on the small gathering guidance. But it's about personal responsibility and community concern. And I'm telling you, compliance is a major issue for us here. I'm also frustrated that we see polls that suggest a high percent of Americans are not ready to take this vaccine. 49% nationwide. Bigger problem in the black community. 57% say they're not ready to take the vaccine. But 75% to 80% needs to be vaccinated to hit critical mass on the vaccination. And that's a problem. If you have 50% saying I'm not taking it, but we have to hit 75 to 80. The good news is New York still has one of the lowest positivity rates in the nation. Only Maine, Vermont, Hawaii are lower than we are. And Maine, Vermont, Hawaii, beautiful states, but different than New York. They don't have the cities, they don't have the density, et cetera. So for us to be down that low is really good news. As a matter of fact, our worst region, our highest region in terms of positivity, is still lower than 41 states. So it's tricky because relative to everyone else, we're doing well, but the real question is, it's not a relative contest at the end of the day. It's how you're doing in your state. So to recap, we're going to monitor the hospital capacity. If it doesn't stabilize, we're going to reduce the indoor dining restrictions. We go to 0 New York State, 25% everywhere else. We close down if you hit critical hospital capacity. We're implementing the surge and flex. We're going to add 25% additional hospital beds, renew the registration for nurses and doctors to get us a backup staff pool, continue to caution on the small spread, And at the same time, we are gearing up to have the most efficient, most effective, most fair vaccination program in the country, reaching out to the black community, Latinos, undocumented, to make sure that it's fair. So a couple of questions for you, Dr. Fauci. That's what we're doing. In general, your opinion has always been valuable to us. The holiday spread, I think it continues through Christmas, Hanukkah, etc. Trying to guess, and I know it's a guess, when we could see a peak to this holiday spread. Is it after New Year's? Is it January, mid-January? Do you have any guess, educated point about that? And again, thank you very, very much for being with us.
Well, thank you very much, Governor, for giving me the opportunity to listen to what I found to be a very interesting plan that you have for New York. It seems really sound, and you have a lot of backup contingencies, which I like. So you're not going to get caught shorthanded on this, I'm certain. So thank you for that. With regard to the issue of the holiday spread and the peaks, they're going to be superimposed upon each other. So you would expect the full blunt of the travel and the family setting gatherings with friends that you alluded to as being a problem. You'd expect that the effect of the Thanksgiving surge would be probably another week and a week and a half from now, because it's usually 2.5 weeks from the time of the event. The problem is that's going to come right up to the beginning of the Christmas Hanukkah potential surge. So you have a surge upon a surge, and then before you can handle that, more people are going to travel over Christmas. They're going to have more of those family and friends gatherings that you accurately said are an issue. So if those two things happen and we don't mitigate well, we don't listen to the public health measures that we need to follow, that we could start to see things really get bad in the middle of January. So I think not only for New York State, but for any state or city that is facing similar problems, without substantial mitigation, the middle of January can be a really dark time for us. But as you said in your presentation, Governor, there are some things that we can do to mitigate against that. I think particularly the appreciation that it's such a natural thing to think when I have family and friends over for the holidays, Christmas and Hanukkah, you get indoors, you take your mask off because you're eating and drinking, and you don't realize that there may be somebody that you know, that you love, that's a friend, that's a family member, who is perfectly well with no symptoms, and yet they got infected in the community and brought it into that small gathering that you're now having in your home. So that's the reason why I want to underscore what you said. That's one of the issues. But bottom line for your first question, mid-January is probably going to be the bad time.
The small spread, family spread, living room spread, we call it living room spread here. So like 16 states have done an order of no more than 10 in a home. The CDC guidance, that's President Trump's CDC, says no more than 10. Some states have gone to no more than 8. Compliance is very low on that. Do you think that is a sound rule, that no more than 10 in the home?
Governor, I think that's a very sound rule. And I feel, 10 may even be a bit too much. It's not only the number, Governor, but it's the people who might be coming in from out of town. You mentioned in your presentation how you don't want somebody who's from New York who wants to go to a restaurant that's closed in New York. They go to New Jersey and then they come back. They've traveled back and forth. In addition to the absolute number of the people in a home for a gathering or a social setting, you want to make sure you don't get people who just got off an airport or a plane or a train and came in from Florida or came in from wherever, that's even more risky than the absolute number. So not only the number of 10 seems reasonable, but make sure that when people come in, that they're not people who you have no idea where they've been or who they've been exposed to. I mean, you want to be friendly, you want to be collegial, but you really got to be careful about that.
Yeah. No, you're so right, Doctor. And the practical implications are so difficult. As I mentioned, at a birthday yesterday, one of my daughters who wasn't with me, who wanted to come up, she had a quarantine before she could come to my birthday, you know. So you want to go travel and see someone, it's not just that weekend. It's the whole quarantining process before. And in this state, we have very strict regulations of when you come in, what you have to do. On the vaccinations, looking ahead, 75–80% is going to be very hard to reach. New Yorkers are tuned in, and we're going to be very aggressive on public education, outreach, et cetera. But what does your crystal ball say? When is 75–80 even feasible? You know, I hear anywhere from May, June, July, August, September. What would you guess there? Which is when it's really over, right? When the vaccination hits critical mass.
Yeah, when you have 75–80% of the people vaccinated, you have an umbrella of protection over the community, that the level of community spread will be really, really very low. The virus will not have any place to go. It's almost metaphorically, if you think the virus is looking for some victims, when most of the people are protected, the virus has a hard time latching on to someone. When that happens, Governor, is going to be entirely dependent upon how well we do, how well I do, you do, your health officials, in getting the message out of why it's so important for people to get vaccinated. Because if 50% of the people get vaccinated, then we don't have that umbrella of immunity over us. But let's say it works out well. Now, let me answer your question specifically. And we do a really good job of convincing people. Between now and the end of December,